Welcome to an historical exploration of health education and promotion from 1700 to 1799 by Katie Bromfield, Steve Black, and Jeannie Byrne. In the 1700s, living conditions in Great Britain were deplorable for most of the working class people. It was just the beginning of the Industrial Revolution, and businesses were in need of factory workers. So many people moved from the country and farmland for factory work. These people worked 12 to 14-hour days, 6 or 7 days a week for very low pay. Men, women, and children toiled in extreme weather in dirty, crumbling factories with dim lighting. Because of poor pay, the workers were forced to live in cramped buildings on crowded streets, loaded with vermin and pests. There were rarely running water and sewage systems, and the people threw their waste into the same streams and rivers that they bathed in. Because of so many deaths from disease, malnutrition, and accidents, the paupers' graveyards were full, and so disposing of bodies was a concern. Bodies were inadequately buried, causing smell and spread of disease. Infant mortality was very high, with some districts reporting a 75% mortality rate for children under the age of 1. And according to church records, more people died than were baptized. In the 1720s, Great Britain experienced a gin craze. This gin was known as Madame Geneva and was very cheap, very strong, and easily accessible to the poor. It was so popular that by the 1740s, it was estimated that 6 gallons of gin was consumed per person per year. This picture is a depiction of the social crisis that gin brought to communities. You can see here that people were dying of disease and malnutrition, and crime was rampant. And the children were harmed or killed by neglect and abuse, and buildings were crumbling from abandonment. In the 1700s, the plague was just beginning to decline, and diseases related to other conditions like alcohol consumption rose drastically. Previously, communicable diseases were thought to have been caused by miasma, which they explained were fumes or a stench rising from decomposing organic matter. Now, however, they're beginning to connect some diseases with poor sanitation and dirty drinking water. During this time, the government was starting to take a closer interest in the underlying health of its population. Counting, valuing were now being applied to population. So censuses, disease statistics, birth rates, and a bill of mortality marked the earliest beginning of epidemiology, which can be seen as the science of public health. Due to the social crisis that was caused by gin, in the 1740s and 50s, British Parliament was forced to introduce legislation which restricted the sale and manufacture of Madame Geneva. And this is very important because it's one of the first instances of a government taking significant steps to intervene and end a pandemic. And this also represents a paradigm shift concerning the cause and the meaning of disease. So experts then concluded that diseases were less natural effects of the human condition and more controllable through public action. In the 1700s, in both Great Britain and colonial America, The average life expectancy was only 37 years of age. Infant and maternal mortality rates were very high, and epidemics like the plague, typhoid, yellow fever, cholera, smallpox, and tuberculosis afflicted many areas, along with diseases like syphilis, measles, and whooping cough. So sanitation was just beginning to be recognized as important for disease control. Isolation and quarantine were found to be effective in containing the spread of diseases. The definition of isolation is separating sick people with a contagious disease from people who are not sick. And the definition of a quarantine is separating and restricting the movement of people who were exposed to a contagious disease to see if they become sick. This picture can be regarded as a syphilis awareness campaign. The man with the white hair on the left is a viscount, and he and his child mistress are visiting a quack doctor. So the viscount holds up a pill box, and he also has a large black spot on his neck. This spot may be a syphilis sore, and the pills are most likely mercury pills. The viewers are made aware of the early symptoms of the disease, how it spread, and the side effects of its ineffective treatments. There's a skull of a previous patient with tertiary syphilis on the table next to the quack doctor. This may be an early. In 1701, Massachusetts passed laws to isolate smallpox victims and to quarantine sailors on ships that were exposed to the disease. After 1721, inoculation with pus from a smallpox scab was accepted as an effective means of containing the spread. And by the late 1700s, Boston, Philadelphia, New York, and Baltimore all had established permanent boards to enforce quarantine and isolation rules. This cartoon depicts inoculations of the cowpox vaccine. Edward Jenner was a scientist that noticed that milkmaids who had cowpox didn't develop smallpox. So he injected a boy with some material from a milkmaid's running cowpox pustule. The boy was found to be immune to smallpox. So Edward Jenner published a scientific paper on his findings, and he even named his immunization a vaccine, which comes from the Latin word for cow. His inoculation method spread quickly around the world, and even President Thomas Jefferson was vaccinated to prove the shot's effectiveness. Pennsylvania Hospital was founded in 1751 by Dr. Thomas Bond and Benjamin Franklin to care for the sick, poor, and insane who were wandering the streets of Philadelphia. In 1798, marine commerce was critically important to the United States, and public health was considered to be the responsibility of the federal government. President John Adams signed an act for the relief of sick and disabled seamen. This act brought about the Marine Hospital and the birth of modern American medicine. John Adams wrote, "I think it is my duty to invite the legislature of the Union to examine the expediency of establishing suitable regulations in aid of the health laws of the respective states. For these being formed on the idea that contagious sickness may be communicated through the channels of commerce, there seems to be a necessity that Congress, who alone can regulate trade, should frame a system which, while it may tend to preserve the general health, may be compatible with interests of commerce and the safety of the revenue. In 1799, Boston created the first Board of Health and the first health department in the United States. Paul Revere was appointed as the first health officer. The board was formed to control a cholera outbreak. So the board put signs on lampposts announcing meetings where public information was taught from health officials, which is the start of health education.